Hello everyone, welcome to Rise IS. I am Alok Bardhan and in today's Prelims Wide session we will discuss a very important article from today's The Hindu newspaper on diabetes and South Asian phenotype. So the title of today's article is India's experience in diabetes care could guide other countries. So this article mainly discussed India's experience in handling diabetes care can guide other low and middle income countries and how diabetes in South Asia is different from the rest of the world because South Asian people has lower body mass index with more visceral fat and which further lead to great insulin resistance. And this article further discussed how we should just not just looking from blood sugar, but we have to see the overall health and well-being of a person in tackling diabetes and how technology can intervene in facilitating or in improving or countering diabetes crisis. So this topic is important mainly because diseases is a most common theme for preliminary examinations. So as you can see, UPSC in 2021 asked a question on hereditary diseases. So disease and questions related in disease which is in news becomes a very important theme for upcoming preliminary exams. So that's why please read this article very carefully and we have highlighted the most important point of this article for your reference. So now let's start our today's discussion with the context of this article. So a recently published article and in research paper Diabetologia highlights South Asians have higher insulin resistance and higher visceral fat and lower body mass index, which further increase the diabetes risk. And these findings emphasize that to counter this diabetes crisis, for a we need a precision medicine rather than uniform treatment models. Now, let's see some important synthesis and function of insulin. So, insulin production naturally occur in our body through beta cell of islet of Langerhans in pancreas. And insulin discovered or identified by Sir Frederick and G. Banting and Charles H. Beast and J.J.R. MacLeod in 1921. And what is the function of insulin? Insulin helps in regulating blood glucose by promoting glucose uptake in liver, muscle, and adipose tissue. And insulin also converts excess glucose into glycogen for storage in storage in liver and muscles. Inhibit fat breakdown and support amino acid uptake and protein synthesis. So insulin also helps fat breakdown and support amino acid uptake and protein synthesis. And low insulin level force the body to burn fat for energy. So in the case of low insulin level, force body fat to produce fat and body fat to produce energy for normal functioning of human body. So now let's see about types and pathophysiology of diabetes. So what is the what how can we define diabetes? So diabetes is a chronic disease caused by insufficient insulin production or ineffective insulin utilization. So due to insufficient insulin production or inefficient insulin utilization, diabetes can occur. And diabetes leads to hyperglycemia, which is high blood glucose and which led to damage of nerve, blood vessel, kidney, eyes, and heart. So we can say diabetes alone itself is not a disease, but it is a inefficient insulin production or inefficient insulin management or utilization, and which further led to, due to inefficient insulin utilization, lead to hyperglycemia, which is high blood glucose, and which causes nerve, blood vessel, kidney, eyes, and heart. Now let's see some major types of diabetes. So first type of diabetes is type 1 diabetes. Type 1 diabetes is autoimmune destruction of Type 1 diabetes occur due to autoimmune destruction of beta cell and requires lifelong insulin therapy. So type 1 diabetes occur due to lifelong destruction of beta cell, and for cure it requires lifelong insulin therapy. Next is type 1.5 diabetes. This type of insulin also called latent autoimmune diabetes. This type of insulin occur in and adult onset, and this type of disease or diabetes called autoimmune diabetes with gradual progression. Now let's see about type 2 diabetes. Type 2 diabetes caused by insulin resistance account for 90, so near about 90 to 95% 90 to 95% of global cases is type 2 diabetes. Now last is gestational diabetes. So this type of diabetes is pregnancy induced hyperglycemia, which develops during pregnancy. So pregnancy induced hyperglycemia can occur during pregnancy. This type of diabetes is called gestational diabetes. Now let's see some important fact about South Asian diabetes phenotype. So South Asian develop diabetes at lower body mass index level. So diabetes along with lower body mass index can cause further problem. So South Asian diabetes phenotype is more dangerous than other European diabetes, and higher visceral fat and greater insulin resistance despite low body weight. So South Asian diabetes has higher visceral fat, great insulin resistance despite low body weight, which cause further problem. The South Asian diabetes phenotype linked to diet rich in deficit carbohydrate in refined carbohydrate and low physical activity. So, due to diet rich in refined carbohydrate and low physical activity can cause South Asian diabetes phenotype. And this supports shift towards precision medicine, tailoring treatment according to individual metabolic profile and risk factor. So, universal one size fit all approach is not being beneficial to tackle South Asian diabetes phenotype. So, to tackle South Asian diabetes phenotype require precision medicine, tailoring treatment, and metabolic profile and risk profile of each patient. So, please attempt this question and comment your answer in our comment section, and thank you for attending today's session. You can download complete PDF from our website, and for further preparation please visit our website and YouTube channel. Thank you.